Day National Virtual Technology Showcase. In this two-day event, we have a variety of speakers, topics, and presentations. The following is a recording of our panel discussion of current events, focusing on broadband updates and our pandemic response and crystal ball project. We are pleased to make this recording available for your viewing.
A lot of ground that we're going to cover in our panel discussion. We're going to range from pandemic response best practices to emerging broadband and infrastructure trends, and finally what we can see the near future look like, and what that telemedicine, how telemedicine is going to impact that. We've already talked about some of the housekeeping items that we want to use the Q&A to generate some chat questions for our speakers after they kind of talk a little bit about their topics. I want to do some introductions. So I want to first introduce Mark Vanderworth. I've worked pretty directly with Mark over the last 2 years. Mark's title, if you look it up, says Telehealth and Telemedicine Advisor / Consultant, but you really need to look at his bio that's published in the schedule. Mark has really done it all. He's played so many roles as a business and a thought leader within the telemedicine space. He really has so much insight. But what I like to say about Mark is that he just really has an ability to recognize and communicate challenges and opportunities in telehealth technology. And that's really what's made him a great asset to the Telehealth Technology Assessment Center. And he's taught me a lot. And as well as our other panelists, Garrett Spargo. I've worked with Garrett Spargo in the Alaska Native Tribal Health Consortium for many years. Probably getting close to 10 that we've worked together. And then Garrett's been at ANTHC for much longer. I would describe him as a technologist, but he also has a really keen insight into what makes technology work for humans. And I attribute that to him having a master's in anthropology. That's how I see that working. Garrett is currently leading our broadband assessment project for TTAC. And he's going to talk with us about that a little bit. He also serves as the Director of Enterprise Architecture at the Alaska Native Tribal Health Consortium. And with that, we will go ahead and get started. Go ahead and take it away, gentlemen. Again, I do recommend that you go ahead and grab your questions, be thinking about those, and keep posting those into the Q&A section over on the right.
So we'll start out with a couple of projects that we're working on through TTAC, and both of these are great little projects. And we'll kind of give you what they are and what they're made up of and what the status of both of these projects are. So the first one is to create a pandemic response action plan. This was started at the very beginning of last year. It was actually started when we thought that pandemic would go away and we would have to prepare for the next pandemic. But basically, the focus of this was to really take a look at how healthcare was reacting to the pandemic. What were the challenges that they were facing that were really critical that they had to overcome? And then create an action plan that looked at each one of those challenges and basically used digital health or telemedicine to address each one of those challenges. In addition to that, we looked at all of the policy implications of all the things that we put into the plan and wrote a complete policy assessment of that and what would have to be done, and also some recommendations to HRSA, one where we coordinated with the ATA and the American Hospital Association, Consumer Technology Association, and others to recommend that the waivers for the pandemic not be lifted last year, but that it be continued for 2 or 3 years as a real opportunity to look at what was going on. The third part will be a look back at hospitals that did implement the technology. What really did happen? What was the results? What did they find? What were their challenges, etc.? The first two are complete. They're published in the Journal of Telemedicine and Health. They're also available on the TTAC website and the toolkits, so you can refer to them anytime you like. Go to the next one, Garrett. So really quick, here are the critical challenges that we identified all the way through. You recognize all of them. If you're running a hospital or working within a hospital system, you know every one of these things. I'm sure that every one of them made you sweat throughout the pandemic, and probably many of them still are. What we did was we examined what each one of these challenges were, and then again took a look at how you could use telemedicine or digital health to answer each one of these things. Give you a couple of examples. Rather than go through the list, I'll stick to examples. So, diverting infection, potentially infected from the hospital. I mean, this is a major issue. Bringing infection to staff and additional patients is critical. So we went through the use of telemedicine to replace face-to-face, telemedicine to replace urgent care, the use of pads on a stick, so that people could, from the outside, could interact with the patient, and so that you could do in rounding within the hospital using a pad and stick as well. And that, by the way, carried through many of these things. And if you really look at this, I mean, a lot of people went, well, we can't afford to do pad and stick. If you had a nurse that was rounding 10 patients during their shift, and they rounded once every hour, that means they made 80 rounds. And in the protocols, they had to change PPE every single time. If you had just 10 nurses doing that in your hospital, that means in one shift, you paid for two pads. It really, I was really happy to see so many people implement this technology, because the payback was over the top and really fast. But again, we went through every one of these things, and if you go to the plan as it's published, you can see how we took that against every one of these things. And one of the things you learn after you go through this is many of these things, many of the problems in the pandemic were really just focused in on the weaknesses we already had in the healthcare system. And therefore, applying digital health and telemedicine technology in workflows can address things that are happening with your hospital every day. One question we asked was, so why do you have a waiting room? Nobody else has got it. We do. But everyone went to virtual waiting rooms pretty much in healthcare. Why do we use 20% of our floor space for something we really do not need? Anyway, I'll end here and just encourage you to take a look. The last part of this, which will be the retrospective on all the 8 hospitals that use this technology, will be published probably the month after next. The other 2 are published and ready.
So the pandemic served in many ways as a spotlight that illuminated a bunch of problems at the local, state, and national level. Mark and the work that was being done with the pandemic response plan was really kind of useful at looking at a specific area of kind of healthcare delivery, but there's a couple broader issues that came up and that was really illuminated by the pandemic. And the big one that I'm focusing on right now is broadband access. More specifically, the pandemic really highlighted the issues of inequitable distribution of broadband in our communities and across our country. And I feel that there are really 4 big points that have become, or 4 key points to make, and then I'll provide some background for them. First, undeniably, broadband has become critical to the pursuit of what you might call the big 3, vocation, education, healthcare. In the past, broadband and internet access played a role in them, but as we've responded to the pandemic, having access to broadband really was necessary to fully pursue all 3 of these areas of life. There's a bit of an issue, though, in that we don't know who does and does not have access to broadband. For there being such a critical service, something that is so fundamental to how people can engage in the economy, in society, and in their own health and wellness, yet we don't know where there are gaps in the data. All that we really know is that we we do not have equal distribution across the country. Broadband access is not equally distributed across the country. And this, quite simply, is a problem. It is, I would say, a fairly big problem. The question is, how bad is it? And this is where it depends a little bit on who you ask and what data set you pull from. 3 different estimates provide widely varying numbers. The official FCC data from their most recent report on broadband utilization put it at around 14.5 million people who lack access to broadband. A group called Broadband Now offers a slightly higher number, saying closer to 41, 42 million individuals who do not have access to broadband. But then we have this third number from Microsoft, which is substantially higher, showing that about 120.4 million people are lacking broadband access. Microsoft's methods in particular were interesting in that they're a large company. They have a lot of computers that they're pushing updates to, operating systems, video game platforms. I mean, take your pick. They are moving a lot of data to a lot of endpoints, and as such, they have a pretty good view into the actual download speeds of these different machines. And so the image that here, the graphic comes from one of Microsoft's mapping tools, where they show on the left the official FCC data, where they're saying people with the dark blue coloration have 80 to 100% of their population covered by broadband. On the right, the Microsoft data shows that those numbers aren't what they're seeing in their data. So no matter what number you pick, it isn't great. But as you look at kind of the actual lived experience of people through programs like Microsoft, the broadband penetration isn't what we would like to see. Now, if we're going to talk about who has broadband access and who doesn't have broadband access, there are really foundational terms that we should be defining. I mean, what is broadband? What is access? And who are we measuring and who is doing the measuring? So the definition has changed a little bit over time, and internationally there are different terms that are analogous to broadband. Broadband may have slightly different definitions elsewhere, but generally it's an internet connection that's always available, and more formally defined by the FCC, it is effectively the number of bits per second of data that can be downloaded and uploaded. The official current definition is 25 million bits per second of download speed and 3 million bits per second of upload speed. This is an upgrade from 2010, where it was 4 megabits per second down and 1 megabit per second up. Before that, a decade or two ago, it was 200 kilobits per second. So it's a shifting number that is framing the broadband or the connectivity needs to have what would be considered a high-speed connectivity. And the definition of broadband expands as the number of services using the connectivity expands, as the number of devices expands. So there are actually calls to continue to expand this to either 100 megabits per second download or 100 megabits per second upload, or potentially making asymmetrical and 100 down, 20 up. Either way, it's a changing number and will continue to change. 2 key things that broadband isn't defining. It is not defining the transport mechanism. It doesn't care if it's fiber or copper, cellular or satellite. It is really looking at the speed of the data, not how the data is moving and what the physical media is that it's moving on. It also doesn't define the quality of the connection. It is defining bits per second, doesn't address issues like latency, jitter, packet loss. And those are important metrics because while you might be dumping a lot of data really quickly through a connection, if there are problems with the network, you will have variability in how the data moves, and especially for video conferencing, that can cause problems. And sometimes that'll cause very significant problems, even on a fast connection. Broadband's not concerned with that quality. It's just about the speed. So if we understand what broadband is, there's a question of what is access and how are we defining as we talk about this lack of access. And it's not as straightforward as you'd imagine. The internet service providers and telecommunications companies report to the FCC what census blocks they can or do offer service to in at least one location. So to clarify, what they're saying is that if a single house in an entire census block either is served by broadband or could, within a reasonable time frame, I believe it's 10 days, if they could be served with broadband, then the entire block is considered served. And so the numbers that are officially coming out of the FCC to say, these people are or are not served, it's glossing over a lot of the local, very specific problems with broadband distribution, which is that it's not necessarily going to cover everybody just because one house has service. So that is one problem. If we ignore that for a moment and say, okay, let's assume every single household in this community does in fact have fiber to the house, copper to the house, has a satellite dish in their backyard, the distribution component is solved, there still is this other issue with access, and it's one that is increasingly problematic as we require broadband for work, school, and healthcare. And that problem is that if you can't afford broadband, you functionally don't have broadband. And so while there may be as much physical access as you want in a community, if community members cannot afford it, they still aren't going to have it and still won't be able to use it. So there are challenges in how we are defining access. Now, the other question is how we're measuring people and how we're doing this definition of who it is that has access. As pointed out, the broadband data at the census block level isn't granular enough. We're painting with really broad strokes, and that means that it's harder to narrow in on specific populations that may be underserved and that may need extra support to get access. The reporting that comes out that's reported to the FCC about who is served doesn't include demographic data, and so you can't really quantify disparity based on race or socioeconomic status. Now, there is an argument that could be made that the census block data could be used to pull demographic information out, and then you can merge that with the FCC broadband data, and from that you can get a sense really broadly of who is and isn't served. But the problem being so very local makes that, I think, an insufficient analysis to make. If there's one upper income community within a census tract or census block that is well served and maybe has very high speed connectivity, all those locations that may be underserved are assumed to have that same benefit. So how we are defining who is served and who is unserved is a little bit too broad still. So if we know that we have these problems with the data that exists, and we know that there is inequality in distribution, there's a bit of a question then as to why we know so little. And one of the key points that folks can keep coming back to is that self-reported data is going to have limits. At the federal side, there are a couple of self-reported data sets on the FCC Form 477. This is coming from the ISPs, where they're reporting who they serve. We've talked about some of those limitations, and the limitations that I mentioned are really focusing on groups, even with the best of intention, even with the most accurate data, they're going to over-report who they're serving. But you also have issues where an ISP can claim to serve a region, even if they technically aren't offering service there. There's an example of a company that was a fairly new company, 6 months old, claiming to offer, I believe, 100% of the people in a 6-state region with fiber service, totaling a $62 million person coverage area, and they said that they served absolutely everybody. And this was across states that didn't have statewide fiber distribution. And so whether accidental errors in reporting or intentional errors in reporting, the self-reported data has flaws. There's also self-reporting from the consumer side. USAC data collects information from people who receive USAC funding, and the healthcare professionals and healthcare providers who report on what services they're purchasing aren't always the most technical. And so in some reviews of the data, these specific data sets that we've done with the folks at the University of Arkansas, we found that the units of measure are inconsistent. People will write in kilobits per second when they likely are talking about megabits per second, or vice versa. They'll also include multiple units of measure, so there will be 100 kilobits per second, megabits per second. Now you can sort through that and generally assume what people are talking about, but again, there's a lot of manual work that has to be done to really clean up a lot of the self-reported data. And there is a question then, okay, so we know there are problems. The FCC is aware of the problems, and there have been a lot of comments and internally from within the FCC and from without, calling attention to these problems. The question of why we aren't requiring better data, or why historically we haven't been requiring better data. And a part of it is that no one's really been requiring it. The regulatory and congressional bodies haven't said we must have better data. There are a few reasons for that, and one of the big ones is that there's a benefit in the companies that have this data keeping it private. There is financial information and competitive information that ISPs have, technology vendors, everyone has in their kind of collective data sets. And so they aren't always going to be the most excited to share the deep, detailed information that they actually have. When you go to an internet service provider and need to see if they can provide service to your house, if you enter your address, they can tell you whether or not they serve you. They can tell you exactly what it's going to cost to receive that service. And they can generally even provide an estimate of how many days it will be until you can be served. And yet we don't have this visibility at the national scale. Technology vendors, we already talked about Microsoft. Any of the large operating system vendors are also going to have some level of upload and download information, as well as services like Hulu, Amazon, Netflix. They all are aware of the speeds at which consumers are downloading media from their services. Video conferencing platforms is an example. We use Zoom here at the Alaska Native Tribal Health Consortium. And as an administrator, you can go into the back end and look at an individual call and look at the megabit and kilobit per second data transmission rates. You can see packet loss and other quality metrics. And so the video vendors themselves also have a very rich data set that can show quality issues as well as throughput issues. And then beyond that, there are also dedicated groups that are doing broadband measurement. I'll talk about them a little bit more later. MLabs and Ookla and others are capturing a lot of data, but for some groups, this data is resold. For others, the data is very large and very comprehensive, but it takes an engineer and some data scientists to really do meaningful work with the data. So a lot of data out there, and yet there isn't a clear requirement to share it really widely and publicly. So knowing that there is a problem, there's a question about what's being done about it. First, the Broadband Data Deployment Accuracy and Technology Availability Act, or the Broadband Data Act, has been passed as of March 2020. This is a big step and a really fantastic effort by to have the FCC improve mapping of broadband access across the country. This is going to improve a lot more the data by making it more granular. They'll be using some geocoded data and shape files, which for those of you who do data analysis and mapping, that's going to make it much easier to work with the data. There will be some mechanisms for conducting audits, for supporting small providers and tribes and improving how they collect data. ISPs are going to be able to provide street-level data, which means that they will be able to provide a much more granular view of where they are and are not offering service. One issue here is that it's an opt-in data set to provide at this time. It is optional, not mandatory. But it's going to really do a lot to improve the data. And importantly, this is also going to offer the ability to challenge data. So as individuals and consumers or groups are saying, what I'm seeing on the official FCC map doesn't match to our experience. We have members in this neighborhood or in this community that are seeking service, and yet they cannot purchase the service at that level, or it isn't physically available. There will be mechanisms for testing that, which is really exciting. There are still some flaws in it. I would love to see some inclusion of cost data or defining accessibility as including some measure of affordability and tying that to cost and performance. There also still is the definition of could serve, which is an ISP being able to say that we could offer service, not necessarily that they are actively serving that area. Another big thing at the federal level is the Infrastructure Investment and Jobs Act. This obviously just recently passed and includes $65 billion for broadband expansion. So this is going to be not just looking at the data, but actually really improving how people can connect. But there are some concerns about that. The maps that could be used to allocate funding and do a lot of the planning at the federal and state level for understanding where investment should be made. There are questions about what maps will be used, how accurate they are. FCC is actively working to upgrade those maps, but I know as soon as those are released, there's going to be a lot of discussion and exploration to understand the strengths and weaknesses of the new maps, so the money can be spent more effectively. Beyond the federal level, a lot's happening at the state level. States have set up broadband task forces, committees, and funds, as well as a lot of independent measurement programs and testing projects. I'll post a link in the chat here after this that includes a link to the Pew Trust's kind of roll-up summary they've done of all of the state-by-state task forces, committees, and funds, so you can actually see who's active in your area, in your state, and possibly get involved if you are so inclined. There's also legislative proposals from the state and federal government, including support for municipal networks. So this would be allowing municipalities to be able to run their own infrastructure and then lease that or sell that to other internet service providers. There are some states that have historically had restrictions around that. And so there's some overturning of that, as well as this question of maybe making that a federal requirement, that those be optional. There's also discussion around the idea of dig once, which is tying Department of Transportation projects or requiring installation of fiber or other broadband services when you're doing a roadworks project. And so that can drastically reduce the cost of putting fiber in or putting other high-speed connectivity systems in. And so there are various proposals moving there. On the private sector, there are a number of different groups that are really actively working on improving mapping. Measurement Lab, or MLab, has a tool called the NDT7 tool, as well as a number of others, like called Murakami. It's one of the other examples, where you can do testing either as a consumer or set up regional testing programs where you're shipping out measurement devices. Ookla has a whole bunch of other data sets that they provide. A company called SamKnows has helped create a FCC testing application. So we're at this point where there are a lot of applications we can use, a lot of ways that we can do testing. There is still a bit of a challenge here, though, in that there are all these disconnected systems where individuals can do a lot of work, but it isn't still the easiest thing to be able to roll up your own, say, community or statewide evaluation program. And for some of the existing large data sets, they're very thorough, very large, and a little unwieldy to work with. So there's some work that can be done there. As I've mentioned, I have this passion for kind of understanding what the cost is of broadband and including that in the discussion of access and in the discussion of equity. Consumer Reports is working with a pretty broad coalition on the Let's Broadband Together initiative. It's a online platform where you can upload a internet service provider's bill, and that will include your address, the service you are providing, and all of the costs associated with it. And they're anonymizing that and then using it to show what broadband costs are across the country. And there'll be some really, I think, interesting information that comes out from there. And so that's been running since, I believe, July. It's something that I would love to see more people actively using and uploading their data, so we have a better picture of what really is available. So the question then, what am I doing in this area? There's a project that the Alaska Native Tribal Health Consortium and the Telehealth Technology Assessment Center are running. It's the Telehealth Broadband Pilot Project. It's a 3-year program funded at $6.5 million from HRSA's Office for the Advancement of Telehealth. And the goal is to measure broadband access, specifically focusing on telehealth. This involves some quantitative analysis, looking at the broadband service in 4 states and 25 counties, as well as some more qualitative measures, looking at a number of video conferencing platforms in different broadband or bandwidth scenarios, and looking to see what is the minimum necessary to do good video conferencing. Now, there's an issue here. We like to have really clear, broad strokes that we use to say, if you have this much bandwidth, your video conference will be great. As mentioned, it's not just throughput. And so we're going to, yes, talk about throughput, but we'll also set some quality goals that you should have if you want to support video conferencing for healthcare. We also want to look specifically at the applications that are out there. Each application has a slightly different algorithm for how they process and encode data. And so we want to run them through a number of automated tests, similar to what TTAC and I did at the beginning of the COVID pandemic, to look at video platforms across different bandwidths. So our goal is to put out measurement devices, map some existing data, and then look potentially more broadly at improving consumer home mapping, not just clinical mapping. In terms of what you can do, there are a few actionable steps. You can connect to local and state broadband groups. Again, I'll share that information in the chat here in a little bit. There is some work that you can do to get as involved or informed as you want here. Whether you like the idea of municipal broadband or if you don't, whether you like the Dig Once proposals or not, or if you are really interested in mapping, wherever your interest is in, get engaged in the conversation. I feel that in the healthcare space, there is a lot of advocacy that we can do to help explain what our needs are, clarify that we don't just care about connectivity between clinics and between hospitals, but given that so much of our services move to the consumer home, that front has become incredibly important for us, and it's critical that our patients have access to broadband. So however we can improve that, I think there's a lot of education we can do. I'd also say when the FCC maps are released, the updated, more detailed maps, review them where necessary, challenge data if it doesn't match what you experience, your community experiences, but we've got a fairly narrow window of time and a huge investment that's about to get made. And so the quicker that we can jump onto that data set and really provide some input and correction, the better. If I'm honest, I have some fears that we're 3 to 5 years too late to this game in trying to improve the data and in trying to improve the mapping that we have in place, because there's a huge investment that's about to happen, and it would be a shame if in this multi-billion-dollar investment we either add redundant services to places that are already served, or that we miss entire underserved communities because our maps are too broad and too poorly defined. Moving ahead, we aren't going to, I think, roll back or undo what we've seen in the last year. The cat's out of the bag, so to speak, regarding the use of broadband for education, vocation, and healthcare. Early, I think in the first year, we were really talking about, I can't wait to go back to normal. People will be all coming back to their offices. Everything's going to return to the way it was. And after year 2, while technically that might be an option, I think socially that interest isn't there anymore. People want to be able to work from wherever they can. They want that flexibility to receive healthcare, whether it's in their home, in their clinic, or at their office. The industries are shifting and the technology is shifting. And the one key thing that's making that shift possible is access to broadband. Now, of course, the issue is going to be once you have access to broadband, there are more things you can do with broadband. And this kind of leads to a forward-facing discussion as we try and understand what is coming down the pike and what will broadband be enabling in the future. And so with that, Mark, I'd like to turn things back over to you as you stare into your crystal ball.
Thanks, Garrett. I've got a couple of questions at the end for you, but I'll save them. So this is the next project that we're working on. We're in the middle of this project. It's called Crystal Ball. Now, since I'm a civilian, it's amazing to me that Crystal Ball doesn't look at things 25, 30 years away. This project is focused on 5 years. And what we're doing here is looking at what the technologies will be, or what are the top technologies that will impact healthcare over the next 5 years. And again, the view of most regulators, anywhere in the world, has been on regulating what already exists, or what's in many cases regulating what's existed for 10 years or more. This is a look forward. And just like the other project, this is put together in a think tank format. So just as pandemic response brought together nurses and doctors and hospital administrators and epidemiologists, technologists, and at least 2 TRCs, etc. This project brings together leaders within the advanced technology world in the United States. It's fascinating, by the way. The whole focus is, what are the technologies and applications that will most impact healthcare in the next 3 to 5 years? Very much at the 3-year level. And in each technology, we're going to basically identify the technology and then level set it. Where are we today with that technology in the market? what kind of spending is out there, what's the regulations situation, etc. What are the applications? And then we'll provide specific examples of what's going on, and then go on a little bit to talk about, some of the actual vendors that are in that game today and the solutions that are actually being used in the United States and around the world. This project is basically in the writing phase right now. We have had think tank meetings over the past 9 months. They've been, again, fascinating. And a lot of the people, when you read the report, will recognize a lot of the people within the think tank. Right now, we are looking at completion of writing the report in February, which is this month, I guess, and submitting the publication for publication in March. And again, we want these projects to go through a peer review process. Both pandemic response and this one will go through the peer review process before they're published and published in the journal. Give you an idea of the technologies that we're looking at, and this is not a finished thing. This is in the writing. So, but basically, we really brought it down to 5 that will really have an impact. Again, we're looking at a 5-year threshold. It's not a long threshold. And the place that we really see the most impact, kind of going to the end of Garrett's talk, is really expanded applications of telemedicine, digital health solutions. We've been forced into it over the past 2 years, and there's been a substantial acceptance level and perhaps the beginning of the cultural change that our futurists talked about before. We're also looking at apps, EHR integration management, BioWare sensors, and we decided not to look at those as separate things, because if you really look how they're being used together. Virtual and augmented reality, we'll talk about a little bit of that in a session tomorrow. The use of drones, robotics, and the last one's kind of came out of the left field as we discussed this, and that was hearables. We're at the cusp of a radical change in the hearables, hearing aid industry, which is to date has been a fairly high cost, complex, prescription-only business. And this is going to radically change with the OTC approval of a Bose device within the past couple of months, and also the advancements in the technology and things like earbuds, to the point where we see consumer products giving you many of the same performance as a hearing aid, but at a fraction of the cost. So that's a disrupting technology. You'll not see artificial intelligence, machine learning as one of those 6, and the reason is because it's in every one of the 6. You really can't do most of these things, just as the futurists told us, without machine learning and artificial intelligence embedded in it. So that will be part of the report, but and there is a section of the report specifically defining it and how it's used, but the assumption is it's using all of them. And thank you.
We still have Jordan on the call?
I think so. But hey, I got a quick question for you, and we can tell the audience. You're kind of in the same, we had the same challenges in my 2 projects, and that was, when you really look into it, the definitions change. And you clearly presented that the definitions that the FCC, the federal government, is using as to bandwidth and what it is and how do you measure it, is different. Are you going to have an influence? Do you believe that your project will influence the way the FCC really looks at and assesses broadband?
I think the FCC is already getting the directions that they need to expand the definition of broadband from a lot of sides. When the definition transitioned to 25 down and 3 up, there was some discussion that wasn't really necessary. But enough outside entities said, we're using this for video conferencing, we're using it for healthcare. The economy is requiring higher speed connections, more locations. They were responsive to that. And I think what we've seen as telehealth and other technologies have expanded their use, that needs only increase. The FCC is hearing that. We're also, I think, seeing an increase in not just the number of technologies that can use broadband, but the number of devices in the average home that are connected to the internet, where we have at any given time, especially during COVID, potentially 2 homeschool virtual sessions running, a work meeting, and a doctor's appointment. Those are 4 high-definition video streams that we need to support. To say nothing of the Internet of Things, all the in-home devices that are constantly streaming and accessing data. Just to have a good experience, we need to increase the number, and I think that is going to come to pass.
All right. Thank you, gentlemen. That was a great, you guys both had a really great content to present. I've got a few questions, and then this is now the time that you guys can post your questions in the Q&A section. We do want to get those questions from you, address those kind of from the stage, just so that we can have everybody kind of participate in that conversation. So thanks for leading us off here, Mark. That's a great question. I want to look at kind of the meeting of these 2 areas that we've talked about and talk about what sorts of future technologies do we feel could be are kind of waiting on an improved broadband environment to really become viable. And I'll toss that to you first, Mark, and then Garrett, if you want to follow up.
Well, this actually will answer a question that I saw on a number of the chats as it came by, and that is, why wasn't broadband one of the challenges that were mentioned? Well, the challenges that were mentioned were basically the business issues that they were facing. It didn't talk about what it's going to, and then goes in and talks about the solution, and part of that is the requirement for broadband. But we really focus on the business issues that were really crippling public health and hospitals. The fact is that we don't have great bandwidth. I mean, by Microsoft's data that Garrett showed us, that's 1/3 of the United States, actually 40% of the United States, that doesn't have good access. I'm a little embarrassed to know that Yugoslavia is substantially better than we are, and I hope the FCC is too. Anyway, the things that we're looking at as far as advanced technology is basically the use of telemedicine as a common way of accessing care. It's less expensive, it's easier, it provides better access. However, to do that, you need broadband, and you need broadband access at an affordable level. So that is a requirement of going forward. And allowing people in hospitals to work remotely, you've got to have broadband. To be able to use virtual urgent care instead of running to the urgent care center, you need broadband. I mean, the whole thing really depends on good broadband, not going to 2/3 of the country, but much better than that. I mean, if you're not really providing care to 95% or broadband capability and access to 95% of the households, it doesn't work. And all you do is you exemplify, accelerate, amplify the inequities that we have within our system.
That's great. Garrett?
Yeah, I would say the new technologies that are streaming data to the cloud. I mean, the cloud has become a more meaningful and significant thing as we're moving more and more data out to it. The number of services that are getting data from a local consumer device and streaming it centrally to then be processed, and then whatever the machine learning algorithm is coming out with, that response being sent back to the device, it requires more connectivity. Now, generally, that isn't going to be as significant as a high definition video visit. But when you have so many applications and services that are potentially simultaneously needing to send data and communicating with one another and with servers outside of your network, it's going to increase demand. And then that's really, I think, the big issue is your refrigerator talks to the internet, whether you want it to or not. That increasingly is a feature on your devices. Your thermostat, your security cameras, everything is using some small amount of data. And As those become more common in households, that's just going to require the improved connectivity, so those other core services don't get impacted. So your many IoT devices don't ruin your healthcare visit and don't disrupt your child's learning. So it is going to be. I'm not certain that there's any one single technology that requires 100 megabit bidirectional connectivity. What we're really going to see is the proliferation of smaller systems that need to have that constant available connectivity.
I'm gonna have one of the user submitted questions here, and I think this is asking kind of a bigger question. We'll kind of scroll down so everybody can read it as you go. But they're talking about their specific program, and they're talking about technology that they're wanting to equip, but they're pretty much on hold while they're waiting for broadband to kind of catch up and to have that infrastructure. What can we what's some advice that you can give to organizations that might feel this? They're kind of have a chicken and the egg scenario. Is do I wait for the broadband to implement my telehealth, or do I get the telehealth and then try to make it so that it'll work within my available broadband? And then how do I even know kind of what to expect on a case-by-case basis?
Yeah, so the ties a bit to some of the comments that Stuart made, and to my background as the technologist who cares more about humans than technology. The new remote patient monitoring technology is, I think, far better than what we used to have years ago. The functions that it provides, the size of the devices, how much you can do with a very low cost system, it's amazing. But if the underlying technical requirements can't be met, if you just fundamentally don't have the broadband, then it is challenging to be able to roll that platform out. So kind of the underlying point of your question, how do we improve this, or should we start rolling out technology before we have the broadband? You run the risk of having a fragmented and fragmented program if you push the technology out before the connectivity is there. A couple ways to approach it. One of them would be to delay rolling it out until you get the connectivity, and then really use this bottleneck, this problem, as a point of education to the legislators and the ISPs to say, this is why we specifically need to improve access here. We have patients that we can manage more efficiently, more effectively, at a lower cost, better outcomes. We can do all of that if we have connectivity, and that helps prioritize some of those underserved communities. The other approach is to say, look, we aren't going to get it in time. We can't wait for this. Then the onus kind of shifts to your organization, your program, to having a onboarding process that includes some evaluation of their broadband capacity. Now, ways that this is approached, you may find you don't have the access in your home, and so I'm sorry, you're not a good candidate for this solution. That isn't a great answer they're going to ever give anybody. The other option is to say, okay, you don't have direct wired service to your home, but you do potentially have 3G or 4G connectivity through a cell phone. So we'll provision a SIM card, and we'll provide a mobile device for you. And we won't necessarily provide broadband to your home, but we'll provide at least the ability to do data transmission in this small local way. Mark, I know your background in patient monitoring is pretty extensive. I'd be curious to hear your thoughts on that.
It basically follows it exactly. I mean, one of the great limitations of any form of telemedicine, remote patient monitoring is just one of them, is you got to have broadband to every home. And it was interesting, that question was asked by, I'm going to go down a rat hole for a second. Sorry about that, everybody. The question was from Arizona. My sister is a school administrator in Scottsdale, Arizona, one of the showiest, wealthiest places you could ever go to. It's one of the only places on earth where I know that if you go to the Lamborghini dealer, they have cars in stock. I mean, this is a showy part of the world. And every time you look at broadband maps, it is the darkest of the dark, and then there's got to be broadband like crazy there. The fact is that with COVID, my sister had in the school had to hand out hotspots to allow children to have access to their school. There were people that did not have broadband, did not have sufficient broadband in Scottsdale, Arizona. So we really have to look at broadband completely differently. I was encouraged by Garrett's comments. You know what? In Scottsdale, Arizona, it's crap. It's one of the wealthiest places in the country. Fact is, if again, all the things that we're talking about here and the things we've talked about for years, the solutions that we're talking about in the pandemic response plan, and frankly should be used in our day-to-day life, require bandwidth. And that's really the only thing I can say is we need to move forward. It's embarrassing, actually. I do work in the Netherlands, and I have no broadband access problems anywhere. I mean, I think I could go to an outdoor toilet and have better access there than I get in some places. Anyway, sorry. Tony was right on.
Well, we're gonna continue this thought. There's a question that popped up in the Q&A that I thought was really great, and I'd like to get you guys' insight on this. So the gist of the question is, hey, if IoT, even if the limited amount of stress that IoT is applying to bandwidth, if that's impeding our ability to do school, if it's impeding our ability to do care in the patient home, are we better off encouraging people not to engage with all these IoT gadgets or IoT healthcare items, and then more focus on kind of what we know exists, video, RPM, things like that?
My first answer, I'll give you a second, Garrett, to think about it, because I saw you thinking, is no. You can't wait to create demand. I mean, the nice thing about these gizmos is they're creating demand. They're also putting much more pressure on the system. But, I can imagine in healthcare, if we wait to make each of the changes that we're talking about, we'll never get there. So it's better that we proceed and put pressure on the system and put projects together like Garrett's putting together, and other projects that they're being put together to really identify these problems. The problems have to be solved, and we can't kind of sit around and wait for them to be solved. The other nice thing about gizmos and applications and RPM and telemedicine and all kinds of the other things that are going out there, it puts everything in real context and the real impact on humans of nothing.
Okay, I think we have time for one last question. This one came in via the chat. So I'm going to show this up here. And I think this raises a really good point. There is, and can you guys see that? There's money coming in. There's an unprecedented amount of money that's being spent on infrastructure, broadband. How can we help focus this on more rural areas where it potentially can do the most good?
I think this is where having an active role in reviewing the FCC broadband maps, I think this is really where the rubber is going to meet the road for a lot of our states. As we've seen in the existing FCC data, lots of rural areas with lots of really great connectivity according to the official numbers. The new, more granular data that are coming out should paint a more accurate picture, but still we're dealing with the issue of self-reported data that may not be representative of the actual lived experience of those in our communities. And when the new maps come out, there will be a fairly narrow window of time that I believe we have to provide comment and correction on the official federal map. That federal map, to my understanding, is going to be used to allocate where the $65 billion in funding goes. So that's step one, help make the federal data better. We're not all going to be able to do that. We won't be able to set up a robust statewide measuring system to challenge all the data in the couple of months that we have between the data coming out and the official allocation being made. And that's the point where getting involved with the state and local broadband groups really is going to be important, because there will be a need to advocate for better understanding where the problems are, and to have a local plan for how that federal money is going to come in. It's one of the interesting things about broadband. It's this national problem that we have, but the solution is hyper local. You can look at a city and there will be neighborhoods and outlying areas that are considered highly covered. You can get gigabit fiber in the main urban hub, but in the rural area you have nothing. Talking to other people who are very active in the broadband space, who are very network savvy, their entire neighborhood is served with very good connectivity, but they happen to be down in a little draw that doesn't have good access, and their primary way of getting connectivity is cellular data, and yet they don't get a cellular signal to the home. So those hyper local issues are going to be, I think, where we can help direct the funding, fill what I'm calling the maps and the gaps in the maps. We've got all these data, help clarify where the data is bad, and then inform that plan as we move forward.
Okay, Mark.
I just completely agree with Garrett. This is a national problem, but the solution is hyper localized, hyper personalized. We need to really look at it to every home and not to some, whether it's rural or urban.
Well, I want to give you, I want to thank you both for being with us today. We're going to go ahead and wrap up our session.